Bill and I are in New York because we're hosting an event called Goalkeepers, and it's really to show what's the progress that's happened on these UN Sustainable Development Goals that were set in 2015, and to talk about the fact that the world has made incredible progress, but that progress is not at all inevitable.
And that's what struck me from the Goalkeepers Progress Report this year. You focus specifically on global health and on eliminating poverty. And you all have been very optimistic, where a lot of people think things have not gotten better. You've pointed out along the way that things have gotten better. But the line that really struck with me was that progress is possible, but not inevitable. What did you see happen over the last year? Is there anything that caused you to think that, or made you think, OK, we've got to be really alert on this?
Sure. Well, as you said, poverty has been cut in half as a world. Childhood deaths have been cut in half in the last 25 years. But we see this youth boom happening now in Africa. 60% of the population there is under the age of 25. And so if we invest in their health and their education, they'll lift up their economies. They have huge potential. They'll lift up the continent. But the converse could also happen. If we don't make those investments, you're going to see more HIV/AIDS. You're going to see more deaths than we've had before. So we need to keep our eye on the ball and make these investments as a world.
What you all do at the foundation is huge work. It's important work. But I know that you also rely on government funding. If they're going to be making these massive goals, things like attacking malaria or trying to eradicate polio, those aren't things you can do by yourselves.
Absolutely not. It's really important to know the role of philanthropy versus the role of government. We can take risks sometimes where a government can't. We can show what works. We can bring forward data. But then it's really government funding that has to really deal with huge numbers of vaccination or HIV, or investing in education. Quality education is a place the world really needs to focus.
You know, we have seen a lot of governments more focused on trying to manage their own budgets and be concerned about these issues. Is that why you're concerned about this? Do you think that governments may step back from some of these initiatives?
I think that as a world, we sometimes think, oh, I've taken care of that issue already. The fact that number of childhood deaths are down, or the fact that, okay, we've put all this funding into HIV/AIDS. But what we need to say is that the world, the high-income countries, need to keep doing that. South Korea used to receive aid, and then eventually it became a middle-income country, and then it was on its way, and we stopped funding it, and it now helps fund the rest of the world. But until some of these African nations move from low to middle income, we have to make these investments and continue to call on their governments to make the right investments in health and education.
Melinda, I saw an interview that you did recently, and you were asked if you had a magic wand, what it would be that you would kind of wave and wave away, or what you would do with that magic wand. And you had an interesting answer. You said you'd focus on reproductive health.
Absolutely.
Why?
Because when women have access to contraceptives and they can choose when and if to have children, it completely changes their lives and it changes their families' lives. We know from great data all over the world now that once women can make that decision, she can lift her family out of poverty, literally. But conversely, if you don't give her that tool and you don't give her education about it and give her access, you keep her in a life of poverty. She's destined to a life of poverty. And so there are 214 million women asking us for the tools that we have here in the United States and in Europe, and we need to deliver them to them.
You know, I thought a lot about that because the foundation has always kind of steered clear of anything controversial because you are doing so much. You've got big goals. You need to ask for help from governments to do that. What actually brought you on your own personal journey to get to that point, to where you thought that this is so important? What did you see along the way?
I met women all over the world. And when I would sit down and talk to them in their homes, in their villages, in a township, and really listen to them, I would often be there to talk about childhood vaccines, and they'd answer my questions, but when I really gave them the chance to talk, they would say to me, what about that tool? What about that shot? They use a shot quite often in Africa for reproductive health. Why can't I get it? They were irate. And they would say, look, I have 5 children. It's not fair to my youngest child for me to have another one. And so finally listening to the women and then coming back and looking at the data, I thought, you know, I can't shy away from this issue. Somebody has to answer those cries, and somebody has to rise above the politics and say, this is important. This has to be on the global health agenda.
Was that a struggle for you personally? Because with your own background and upbringing, that wasn't necessarily something that you thought growing up, right?
You bet. I'm Catholic.
Yeah.
And I had many discussions with my family, my immediate family, my parents, my siblings. I had discussions with former priests and nuns. And at the end of the day, I decided I use these tools. I counsel all 3 of my children, my son and my 2 daughters, to use these tools, to know about their bodies and know about them. And I thought, I have to follow my conscience. You know, women's babies are dying because they're coming too quickly. And the women's bodies, they can't sustain what's going on. How can I not answer those calls? So at the end of the day, I had to wrestle with my conscience, and my conscience says this is the right thing to do.